Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Today, a look back at health policy in the first 100 days of Trump's second presidential term. I speak with Dr. Josh Sharfstein, a former federal health official and current health policy distinguished professor of the practice in health policy and management. Just a reminder, as always, these podcasts are a conversation between the participants and do not represent the position of Johns Hopkins University. Let's listen. Dr. Josh Sharfstein, it's a pleasure to have you back on the podcast. We've been covering some of the health policy developments with the new administration, and we keep saying we're going to circle back. And here we are at the end of 100 days. How are you?
I would say I'm doing okay. It's been quite 100 days.
Well, we could start with some changes for global health.
Changes for global health were profound. The U.S. Agency for International Development has in the past supported critical health work all around the globe, and the agency pretty much got wiped out. I think an agency of thousands of employees was taken down to something like 15, and hundreds of millions of dollars in grants were canceled. And that's had an impact in nutrition programs, in HIV programs, in environmental programs, in pandemic preparedness programs. The field of global health is really reeling at this point, and that happened very quickly.
It seems like of all the things that we're going to talk about today, this is the one that happened so quickly and at such a large scale. We are already seeing some of the ramifications.
The stories that are coming out are really gut-wrenching. Babies that are dying because they are no longer able to get medicines, patients no longer able to be treated for tuberculosis, and all kinds of systems that were set up, systems to provide care for thousands of patients, systems to identify pathogens that could become a pandemic. Those systems are being taken down or have been taken down.
Do we know what comes next for these programs or what the plan is?
I don't think there was so much a plan from the federal government. I think it was to end global health investments. I think, as you may remember, some of the administration officials took pride in doing so, maybe a strange sort of pride. But the better question is, what's the plan for global health moving forward? And I think the community is very much scrambling to figure that out. Will other countries be able to fill the gaps? Will other structures grow up in the place of USAID internationally? This is really a really important moment because at stake is a lot of progress that has been made. Progress in reducing mortality, in saving lives, and allowing many people to have futures that they couldn't have possibly had just a decade or two ago.
So here in the U.S., we have also seen some pretty substantial changes to our health policy infrastructure. What's happened there?
Well, I think we're starting to see that the new administration is absolutely dedicated to transforming the Department of Health and Human Services. And that transformation includes profound downsizing with tens of thousands of employees either being pushed out or coaxed out or outright dismissed, as well as a huge restructuring of the department alongside the dismissal of a lot of the leaders of key programs, and in some cases, the elimination of key programs. I think what's left of the department will become clearer over the next couple months, but it's no doubt that it's going to look very different than where the department started, and that the functions of the Department of Health and Human Services are going to be significantly restricted, which will have implications for the health of communities all across the country.
There's been an executive order called Make America Healthy Again, and it seems like there's an intention there to address the U.S.'s mortality gap and chronic disease, among other things. Have we seen how this is taking shape with HHS restructuring as a priority, or is it still too soon to tell what this is going to look like?
That's a great question. So I think there is an appreciation that the new administration and the new secretary in particular is asking big questions about American health, like why our life expectancy is falling behind so many other countries. But there isn't an understanding yet of what this tangibly means for what they're going to try to do about it. We know that they're planning a new administration for a healthy America. That's what it's called. But they're collapsing and eliminating functions and kind of bringing it all together into this agency that hasn't been that well defined. They've, in the budget, said they'll have $500 million for new activities to make the country healthier, but we don't know what those activities are. There's a Make America Healthy Again commission, but it meets behind closed doors, so we don't know what it's really discussing or what it will recommend. So I guess the big picture is there's a lot of public health infrastructure being lost, and there is a suggestion that maybe we'll get something back in return, but we don't know much about it.
What have we seen so far in terms of vaccines?
So I think I know why you might be asking that question. There are a lot of questions about Secretary Kennedy taking this role, given his past as someone who was quite critical of vaccine science, vaccine scientists, and now he's leading the Department of Health and Human Services. And the answer is there's a lot going on about vaccines. I would organize this into vaccine resources, vaccine information, vaccine research, and vaccine policy. Can I walk through those?
Let's do it.
So vaccine resources, we're seeing that there have been pretty significant cuts in resources that are available to explain to people about vaccination, as well as to respond to diseases that could be prevented by vaccines, particularly measles. We have a big measles outbreak in this country, the largest in decades, and HHS is cutting the funds for states that can be used to respond to these outbreaks, and people have been dismissed from CDC who have been related to the outbreak response. So vaccine resources has been a challenge. Number two, vaccine information. In the middle of this outbreak, we're getting Secretary Kennedy saying all kinds of things that are not true about the measles vaccine and about ways to treat measles, saying that, for example, it could be treated by cod liver oil, even though there's no evidence about that. HHS dismissed the leading vaccine regulator, and on his way out the door, Peter Marks, said that he had been asked to find evidence that the measles vaccine was causing encephalitis and death. And he couldn't find that evidence, and he thinks that may have been one reason why he was fired. So a lot of challenges in the area of information. Vaccine research has been significantly curtailed, particularly research related to vaccine hesitancy, understanding why people might not be vaccinating their families, and establishing ways to effectively communicate about people so they can make good choices to protect themselves and their communities. And then there's vaccine policy, which is a broad topic, but we're hearing lots of little suggestions that the administration wants to make some changes, some of them maybe not so little. One that's come up is, will there be a new policy for the approval of boosters for COVID-19. These have been approved in the past based on evidence that they're targeting the strains that are circulating of COVID. But we now have the FDA commissioner and the HHS secretary signaling that maybe we need to do more studies. Exactly why we need to do more studies, when, what kinds of studies, those are details that haven't been made clear. But the idea that there could be new requirements has raised the question about whether booster shots will be available and the consequences of them not being available. So we'll have to see. I certainly hope there's a lot more transparency about major changes in vaccine policy.
With all of this, how worried are you about vaccines in the U.S.?
So I'm worried. I'm a pediatrician, and in my training, I took care of kids who were very sick and even died from diseases that are now preventable from vaccines. And I do not want to see those diseases come back. I do not want to see the families suffering like I saw those families suffering. And I also have worked at the Food and Drug Administration, and I know how important sound policy is to the development of products that really can have a huge positive impact on people's health. And I don't want to see that whole world disrupted in a way that makes it harder for us to get safe and effective vaccines for diseases that we are now experiencing. There's a lot at stake here. There's a lot at stake for the progress that we've made and the progress that we could make. So this is an area I'll be watching closely.
Early on in our discussions, there were these big concerns around communications pauses, like health agencies weren't even putting out information. Now, we know a lot of these agencies obviously now have had these massive personnel cuts, but what have we seen in terms of some of the regular reporting and communications that might have been there before this administration?
Well, I mean, I think one of the really critical things is what you just said. They've fired some or all of the communications staff at HHS in multiple agencies. So there were huge losses at the Food and Drug Administration. So you're losing people who really understand how to communicate about the risks and benefits of medical products or food safety at CDC. I understand huge parts of the social media team were let go, key people in the communications office. And so there have been all these reports about all kinds of interesting and important information that hasn't gotten to the public because the communications offices have been shut down. That's a big deal for communications. Now, the administration says, well, we're going to set that up again at the department level. Why it all had to happen with this huge gap in the middle, I can't answer. And how well this is going to go when you're hiring people who don't know these programs at to a different building, I don't know that either. So I think that's definitely one of the more serious consequences of all these changes in the short term. And then there are other aspects, like we still don't know the fate of some of these data sets, whether they'll be changed. We saw that a lot of people were let go in the Freedom of Information Act office, which is a really important part of sharing information with the public about what agencies do. So there's a lot going on there.
So let's look forward a little bit and see where we are on topics like, for example, Medicare, Medicaid, and the budget. What's going on there?
Congress has adopted a budget blueprint that calls for enormous cuts in spending. And one of the ways, and some people argue the only way that Congress is going to get to that level of cuts will be to cut Medicaid, the program that primarily serves low-income Americans, but also quite a lot of middle-income Americans as they get older. It's unclear what's going to happen. The messages from different senators and even from the president are kind of mixed. Will Medicaid get cut? Will it be cut profoundly? And what it'll look like on the other side? Very unclear. And so that's probably one of the biggest policy issues going into the summer. My understanding is that over the next couple months, this will take shape.
What do we know right now about the Affordable Care Act?
Well, there's not a big movement in Congress to repeal the whole Affordable Care Act, but there are a number of important issues that are coming up, including whether the extra subsidies that were put into place will be continued, which makes care and coverage much more affordable for Americans. And there are also some other programs that were set up by the Affordable Care Act that the administration may try to change the way that they're implemented. But I think that it has taken a little bit of a backseat to some of these other major shifts.
We've been living through the last 100 days kind of through breaking news updates. Can we zoom out a little bit and get some perspective on what is the story that has been taking shape here?
Well, before the administration started, the big question was, will this be a big change or a little change? And we've answered that question. This is a big change. It is a profound change to global health, and it will be a profound change to health here in the United States, too. All of these actions that are being taken, the massive cuts in grant funds, the loss of so many staff, the consolidation of agencies, those are hitting different programs that affect the lives of millions of Americans every day. So we are going to start to see the health impacts of that all over the country. But I would be remiss if I didn't point out that a lot of these changes are being challenged in court. There are multiple lawsuits that are ongoing. In some cases, some of the actions the administration has taken have been paused by judges. And even today, as we're speaking, a number of states filed suit to try to stop the restructuring of the Department of Health and Human Services, stop the creation of the Administration for Healthy America, and go back to the old structure and make sure that all those functions are able to continue. The states are arguing that they were relying on CDC and other federal agencies for certain functions, and now all that work is getting dumped on them, so they have standing in court to sue. It's going to be interesting to see what happens there. So we have seen big changes, but there still are big questions about how lasting and how consequential these changes are going to be.
Just a logistical question there. can you put the toothpaste back in the tube with some of these things? Like, even if they're reversed, people have been let go. I mean, how would you even begin to reinstate this stuff?
I think the answer is you can get some of the toothpaste back into the tube. So it would really depend. But if HHS is ordered to create a lead poisoning program again, where, for example, they have fired everyone apparently in the lead poisoning program at the injury center, and as a result, when cities have challenges with lead poisoning, nobody's answering the phone. Well, if the court says you have to put that back together, they'd have to put that back together. And there are people who could do that, for the CDC. If a judge were to say you really do need a laboratory to assess for a particular pathogen, where CDC used to be one of only 2 laboratories in the country that could do it, then they'll have to find people to run that laboratory. So I think it depends. And again, that is part of the uncertainty that we're in. So we started with a lot of uncertainty. Now we have big changes, big consequences, and still a lot of uncertainty.
Well, as always, through this whole process, we will once again check in. Maybe in another 100 days, we'll see what the iteration looks like. Thank you so much for your time and your perspective.
Thanks so much for having me, Lindsay. Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.